Hello and welcome to my first podcast. My name is Stephen and I'm from StopCovid.World. Today the topic is R. R is a number, but R also represents a crucial quantity in virus spreading. It's called the effective reproduction number, and it determines how many people will die and whether we will stop the virus. This is a podcast from StopCovid.World. Act now to save lives. So R is a letter, and it means this effective reproduction number. What exactly does that mean? It's an answer to a question. How many people does an infected person infect? The answer is R, the effective reproduction number. But what does that really mean? Let me illustrate. Imagine Fred has the virus. He goes to meet his friends, Charles and Peter. They themselves infect 2 more people each. Those 4 people infect 8 others, and those 8 infect 16 more people. And as you can see, from a small beginning, this virus has suddenly become huge. This is called exponential growth. Let's imagine a different case. Let's imagine that each person infects only 1 other person. R equals 1. So our family of 4 here infect only 4 other people. Those 4 people infect 4 more. The virus is still growing, but it's not growing at an explosive rate as it was before. It's manageable, it's under control. Compare that to R equals 2, where in just a few steps we had 63 people infected with the disease. You can see how diseases can spread very rapidly and can overwhelm the capacity of health systems to cope. Now consider if we manage to get this number below 1. Let's consider R equals half. 4 people have the disease, but each of them only infects half another person. So it takes 2 infected people to infect 1 uninfected person. You can see that the disease dies out rather quickly. So what's the case? Is R greater than 1, meaning that we have an explosive exponential growth, or is it less than 1? Well, let's have a look at what the R0 number is. The R0 number is the case when we don't have any interventions. It's like the R number if we just leave it to go run riot. For COVID-19, the current coronavirus, we think that the R0 is between 1.5 and 3.5. So not so far away from our 2 that we assumed earlier. Incidentally, the fatality rate is between 0.7 to 3.4%, which is quite substantial. If we're thinking of a large fraction of our population getting this disease, that could mean that up to 1 or 2% of the population will be dead within a couple of months if we don't control this virus. So it's nothing to be laughing about. And if we look at what's happened in terms of the number of cases and the number of deaths, we do indeed see an exponential growth, first in China and now for the rest of the world. In between was the point where China had stopped the virus, but the rest of the world was only just getting started. Similarly, the deaths also follow this exponential graph of increase. Now, these graphs are quite hard to see much about it. We can't really see from this whether we're actually coping in the graph. And sometimes we can then shift from a linear graph that goes up in equal increments to a logarithmic graph, which looks like this. Under a logarithmic scale, each increment of the vertical axis represents a multiplication of the number of cases. So we go from 1,000 to 10,000 to 100,000 to 1 million. And that can show us if the growth rate is increasing, which is a sort of a curvature upwards like this period, or the growth rate is slowing, which is a curvature this way. The fortunate thing is there is some sign of a little bit of curvature that way, which shows that potentially the graph is slowing down a little bit. But the question is, what will that mean for total number of cases? And will we actually see another take off like we had before? It's not the first time that it started to slow down, but before that was in China. But then it took off in the rest of the world. So let's have a look at these logarithmic graphs, and we can plot these dotted lines which show how fast it's growing in a particular time. If it's doubling every 2 days, it's following this dotted line here. If it's every 3 days, it's the dotted line in the middle there, which you just about can see. Every 4 days, this dotted line. Every 5 days, this dotted line. And you can see that a couple of countries have controlled the virus completely. One is China, which is over here, and the other is South Korea. And they've gone from exponential initially to flattening out so that it's controlled and even stopped. On the other hand, the United States is still going up pretty much exponentially. There is some sign of curvature, meaning a reduction in the growth rate, but that reduction in the growth rate doesn't seem to be enough to actually stop the virus. We're still looking at perhaps 1 million or more cases. So what are we doing here in the UK? Well, this is the government advice. It's that we should stay at home, only go outside for food, health reasons, or work, but only if you cannot work from home. If you do go out, stay 2 meters away from all other people at all times. Wash your hands as soon as you get home. Do not meet others, even friends or family. You can spread the virus even if you don't have symptoms. Unfortunately, not everyone is listening to this advice. At least in the United States, this was Miami Beach a few weeks ago. Hopefully that's now changed. And if you intervene early, you don't need such stringent lockdowns. Singapore, South Korea, and Taiwan did a lot of testing early on, and that meant they didn't need to do all of the massive lockdown because they traced every single person that could potentially have had the disease. But we in Europe failed at this early on, haven't done much of this detection and isolation, so now we're forced into the full lockdowns. The question is, will the lockdowns be enough? So how do we need to get below 1? Well, we don't really know. This is from Thomas Prieo's article, The Hammer and a Dance, on medium.com, and he argued that we might need some of these things, all of these things, perhaps, to get R below 1, but we didn't really know what were the interventions necessary in order to do that. So this is how the world locked down due to COVID-19. This was only a few weeks ago, on March the 13th, that we had a complete lockdown only in these purple countries, Ukraine and Italy, with partial lockdowns in the red countries. That is Japan, South Korea, China, Iran, Iraq, Eastern Europe, and Spain. Have a look at the situation now, only 11 days later, and we have a severe lockdown in India and Pakistan, in many European countries, South America and Africa, with partial lockdowns still in the United States and many other countries. So what does it mean for R? Well, this is the case. This is a research that came out only today by Imperial College, and it shows R as a function of time after different interventions. The first was self-isolation, which brought R down from maybe 3.5 to around 3. Then we had social distancing, which reduced it slightly. Then we had school closure, reduced it slightly again. And then we had a full, complete lockdown with public events banned, and that had a big impact. However, the 50% likelihood value of R still straddles 1. So it's possible that R is now below 1, but it's also more likely that R is still above 1. And I can't emphasize more enough that the difference between an R greater than 1 and less than 1 is massive. It's the difference between this and this. It makes all the difference. And even if it's only a little bit above 1, this virus spreads so fast that we will still soon be in a situation where the whole country is overwhelmed with the virus. So if R is growing greater than 1, the infection is growing, and it's growing fast. That means that a large fraction of the population will get the disease, and fast. This will overwhelm, even surge medical facilities. So let's say that 50% of 60 million UK citizens get the disease, and 5% of those people need critical care. That's 2.5% of the population needing ventilators, or 1.5 million people. That's well above the tens of thousands ordered, even rapidly built ventilators will not be enough. If R is less than 1, however, it is under control. We don't currently know whether R is above 1 or below 1 because we have poor lagged data. It is vital that R is brought below 1. We need good data on what works, and we need stronger measures. And just to emphasize that again, the difference between R of 1.5 and R just less than 1 is the difference between a complete catastrophe and a situation where we have the virus under control. Key points: we need good data as to whether R is now above or below 1. This means statistical real-time testing of the whole population and rapid modelling. And as is likely, if R is still greater than 1, we need a stricter lockdown. We need to put everything at this virus to save our elderly people who are in great mortal danger from this virus. We are not too far away from stopping this virus, but still, so long as R is greater than 1, most of the population will get the disease and healthcare systems will be overwhelmed. More is needed. Please join, share, and pass this message on to your elected representatives. The website is StopCovid.World. Thank you for listening, and please stay safe and practice social distancing, wearing masks, washing your hands, and taking care of everyone around you.